Number one, saline versus silicone. I always tell patients saline is going to give you a less natural result because you feel the difference in the water on the inside, versus silicone, which has a softer, squishier feel. It feels more like natural breast tissue. So I always generally recommend going with a cohesive silicone gel implant. Second question people usually ask is where the incision should be. There's lots of different places you can put an incision, whether it's in the armpit, through the areola, under the breast. Each has its pros and cons. For me, I really prefer the areola incision because I find that it gives the finest scar. It's well hidden. It's just a half circle incision, no removing the areola or anything along those lines. People always ask about whether the nipple comes off. Absolutely not. And it gives me good access to the inside of the breast pocket. Lastly, it really gives me excellent control over the entire breast pocket, so I can make adjustments in the bottom of the breast or the middle of the breast without worrying about an incision getting in the way. For those patients who have very, very small areolas, which is pretty rare, those are the people that I would put an incision under the breast to get access for implant placement. And then one of the other questions I'm always asked is over versus under the muscle. And what people don't understand is it's not totally over or under the muscle, it's partially under the muscle. So when you have the implant in here, the muscle is covering the top and middle part of the implant, and it's going to give you a nicer transition zone over the upper implant and better looking cleavage in the middle for a more natural result.